Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about subclavian artery disease.
Now, subclavian artery disease occurs when there's a blockage in the subclavian artery. It's a big artery that leads from the heart to the arm, and it supplies part of the back of the brain. So the subclavian artery blood flow is important to all of us. It can manifest itself by pain or weakness in the arm, can also result in strokes, various kinds of strokes. So controlling the blood flow through the subclavian artery is important. And we also know that about 3% of our population have subclavian artery disease. But it is also associated with other things, heart attacks, disease in the legs. It is a manifestation of peripheral artery disease affecting the body, occurring likely in other areas. So we've got to be aware of this syndrome, and we also have to be aware of what we can do. Because in today's world, we can put a stent or balloon in the subclavian vessel and perhaps prevent some of these major problems, such as stroke and weakness in the arm.
So if I had a friend or loved one who was recently diagnosed with subclavian artery disease, what would be some of the questions I should tell them to ask their doctor?
Good question. One of the things would be, now I know I have this blockage, it's up here, and how is that affecting me? Is that affecting my brain? Am I going to have a stroke from this? Or if one has had a stroke, how could you prevent it? How important is controlling my blood pressure in this particular disorder? Are there medicines that I can take to prevent the blockage from getting worse? In other words, cholesterol-lowering drugs like this. So controlling the overall activity of your heart, your activity of your body, getting good exercise, keeping your weight down, managing the blood pressure, and if blood thinners are needed, making sure that the doctor, and of course, when the doctor sees you, you can ask the question, are the blood thinners being managed correctly? Am I taking enough of these blood thinners? Or if you're not taking them and you have some of these problems, should I be taking blood thinners? Would that be something that would reduce my risk for problems in the future?
Thank you. And thank you for watching. And be sure to visit hearthealthcommunity.com to learn more about subclavian artery disease.